Confirmed COVID-19 cases continue to rise in the Philippines. The country is under a state of health emergency, and government agencies are ramping up efforts to control the spread of the virus. JC Cosico is at the DOH headquarters to give us updates. JC.
Yes, Robbie, the health department has reported 16 new cases of COVID-19 in the Philippines. This brings the number of total infections to 49. These new cases are all Filipinos and most are admitted in hospitals in Metro Manila. Meanwhile, patients 25 to 28 and 30 to 33 are now in stable condition. Meanwhile, 3 are still in critical condition, including case 5, a 62-year-old Filipino, as well as case 9, an 86-year-old American with travel history to the U.S. and South Korea. Case number 29, the wife of case 9, meanwhile, is now intubated due to cardiovascular and endocrine conditions. Both have pre-existing health conditions. Meanwhile, case number 25 and 26 are at the J.B. Liga Memorial Regional Hospital, while another is still quarantined at the New York City pending the test results. Meanwhile, the DOH also reported that there are 6 foreign nationals who had travel history in the Philippines who tested positive for COVID-19. These were 2 Japanese, a Taiwanese, an Australian, a Singaporean, and a South Korean. Both the Japanese and Taiwanese are confined in undisclosed health facilities. The Australian and Singaporean are under home quarantine, while the South Korean is still for verification. Meanwhile, those who had the interaction with the repatriates or the case number 25 and 26 are now studying the latest cases on this. Meanwhile, the agency also dismisses fake news reports urging everybody to stock food supplies due to a supposed lockdown. Meanwhile, Robbie, 442 out of the 445 repatriates from the MV Diamond Princess cruise ship in Japan have already finished their 14-day quarantine period, and now the FDA is saying that the local test kits made by the UP is expected to be rolled out by next week. This will be on top for the 300 tests that can be done by the RITM. Robbie?
While the number of COVID-19 cases continue to rise, Health Secretary Francisco Duque III says the challenge is to delay the spread of the disease from reaching an epidemic peak.
Speaking before lawmakers, Health Secretary Francisco Duque III admitted that he could have declared a state of public health emergency early on.
Being a member country of the WHO, ipinaubaya po namin yung kanilang pag-declare ng public health emergency of international concern. Yun lang po. It's a de facto declaration on my part.
Sa tingin ko mahalaga na prior to the declaration of the President, no, dahil kayo ho ang nasa pangunahing may poder nito, ay nagdeklara kayo para ang lahat na agencies ay ma-forward na, no? Makapaghanda na. No? Dahil ho ang tingin ko parang pardon my term, nagkampante tayo.
Yes, I will concede to that.
The country is currently under Code Red Alert Sub-Level 1, after the DOH confirmed the first case of localized transmission. But as per Duque, the Philippines is still far from what is called an epidemic peak, where cases number by the thousands. But this is no reason to be complacent.
We still have resource limitations like most other countries. And from number of available isolation rooms to ICU during epidemics.
Duque said the objective now is to delay the epidemic peak, which could be effectively achieved through social distancing. But Duque admitted that this will be a challenge.
Pagtugon naman sa mga atin mas mahihirap na mga kababayan, yung mga informal settlers, yung mga sumasakay po sa mga mass public transport, talagang napakamalaking hamon po ito.
During the Senate hearing, the Secretary also said that 3 more foreigners caught the disease after visiting the Philippines, including a Japanese national who spent 7 to 9 days in the country, a Singaporean who stayed for 3 days, and a South Korean who spent 2 months here. Meanwhile, abroad, more Filipinos are also catching the coronavirus disease. The Philippine Consulate General in Hong Kong reports a 5th Filipino tested positive for COVID-19, while 4 other Pinoys are currently under quarantine. 95 Filipinos overseas have tested positive. 80 are in Japan, 6 in the US, 4 in Hong Kong, 3 in Singapore, and 2 in the United Arab Emirates.
A number of areas have declared localized lockdowns due to COVID-19. National police leaders say the PNP is ready should the entire Metro Manila be placed under more extreme measures. The Wakwak Golf and Country Club in Mandaluyong is now closed until further notice after a guest who accompanied a member tested positive for COVID. The foreign visitor reportedly found out he was infected when he had already returned to Singapore. Mauban, Quezon has no confirmed cases, but the LGU has nonetheless ordered the lockdown of the municipality's Cagbalete Island until March 23. The Philippine National Police says it is ready to mobilize thousands of officers, up to 40,000, they said, should there be a need to implement a lockdown for the entire Metro Manila.
We will be utilizing the NCRPO has a strength of around 28,000. The Philippine National Police here in Camp Crame to include national separate units is around 10,000. So more or less we have 30,000 to 40,000.
The Department of Education is still weighing options to tweak what remains of the school year now that classes in Metro Manila have been suspended for the week and the possibility of longer suspensions are being floated. Speaking with One News Agenda, Education Undersecretary Nepomuceno Malaluan says the DepEd has a dedicated task force mulling their options, and the department will have to be open to suggestions as the national situation remains fluid. Meanwhile, education officials have instructed schools in Metro Manila to stagger fourth quarter examinations originally scheduled for next week so as to at least lower the number of students in school per day. Schools have discretion to schedule or, if they deem it prudent, to postpone or scrap their respective graduation and moving up rights in April.
In fact, yung class days na yan, hirap na hirap kami ngayong ipatupad yan dahil napakaraming holidays over the years. So we need to really think of these things in terms of technology, itong mga risk factors like we have had, and also the new way things are being done.